you start developing a story based, you can say, image of the surgery. आपके साथ क्या होता है कि why you feel it tough, why you feel it lengthy, because you try to connect the disease and you try to connect the disease with the surgery, but you don't know the gross pathogenesis behind that. You don't know the basics. You start struggling with the anatomy by the time you're in the, you can say, fourth prof. That's the part two of your, you can say, phase of your life. So वहां पर जाते जाते वो टफ लगने लगती है. लेकिन अगर आपको वो उसका, you know the intro, basically the intro is surgery of the surgery's anatomy. So when you know the intro, when you know the pathology, so वो जो story building concept होती है ना, वो timeline based approach होती है. It becomes very easy. When I was in MBBS, I had studied the Bailey and Love at that time. लेकिन अभी क्या ट्रेंड हो गया है, नो वन स्टडीज बिली एंड लव, यू पीपल स्टडी द इंडियन बुक्स. आई एम नॉट सेइंग द इंडियन बुक्स आर नॉट गुड, but if you see the chronology of these Indian books, they're more like, okay, you have a disease, we have 10 points regarding that, we have a surgery and surgery is being explained. So they believe that you know everything, and that is how you start finding it lengthy. So length is actually, if you go retrospective, length is just because you don't know the subject. If you know the subject, if you know the idea behind the subject, you'll always find it easy. तो सर्जरी को इजी या टफ परसीव करने के लिए यू नीड टू हैव द कॉन्सेप्ट्स. अगर कॉन्सेप्ट्स अच्छे हैं, you'll find it short, you'll find it crisp. But if the concepts, the base is not good, you'll always find it large, lengthy. This is why it is seemingly tough for a lot of you.
Okay, sir. Sir, I would like to ask, is studying surgery for the professional exams and for the competitive exams like NEET, PG, and INI-CET, are they different or the same?
This is where the intelligence comes. देखो क्या होता है कि lot of you believe that I will make mnemonics, I'll make you can say a point wise approach, and I will mug up these, and these are the points, these are the PYQs, these are the questions which have been asked. So let me mug up 10 points and then just vomit it, and this is going to help me in my NEET PG or INI-CET. This is wrong. This is wrong. Remember, when we talk about surgery as a subject, you study it only once. दोबारा पढ़ना ही नहीं है. You read it for final year, you read it for your life, you read it for your prof, you read it for your surgery residency. बच्चे, surgery is not going to change. Calots is not going to change. आपको लगता है कि surgery is different for the MBBS students, surgery is different for the PG students. ऐसा कहीं नहीं है. The only difference between you and them is that you study, you don't practice. They study and they practice. And that is why you start getting or widening that gap कि यार उनको तो बहुत कुछ आता है. उनको बहुत कुछ इसलिए आता है because they are conceptualized. And that is the same thing. If you talk about me, now it's more than a decade I have been teaching, and I have been teaching to everyone, rank 1 also, rank 2 also. I've been into this industry and I know everyone. And you know, take my words, toppers are the students who have good concepts only. Why in final year, why with internship you are able to put a good rank? Because you don't know a lot of things, but whatever you know, you need it, you know it in a conceptual way. So वो जो प्रैक्टिस है ना कि यार मैं निमोनिक बना के रट लूंगा या रट लूंगी या आई विल मग अप द थिंग्स, दिस इज नॉट गोइंग टू वर्क. रिमेंबर, स्टडी द बेसिक्स, and from those basics the questions are created. So this is what is very, 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 very important. So I would say there is no difference between INI-CET, between NEET PG and your final year exam, but the only difference is there you have MCQ. So you need to learn that art of segregation, and that is how you develop that by practicing with test series and MCQ based questions. In the second, in context to the, you can say, university exams, you have to write the question, and when you know the concept, then only you will be able to draw the, you can say, timeline. You have to draw an algorithm, you have to frame the answer. That's the only difference. Lekin the concept is not going to change. Rather, it is only once that we study surgery. So चाहे वो एग्जाम के लिए हो या प्रॉफ के लिए हो या फिर वो आपके यू कैन से INI-CET और NEET PG एग्जाम्स, कॉम्पिटिटिव एग्जाम्स के लिए हो, it is not going to make any difference. You study surgery only once. Like you say, no, you live life only once. That's the same thing. You study surgery only once. आप MBBS लेवल पे भी वही पढ़ोगे जो आप इंटर्नशिप लेवल के बाद आप NEET PG क्रैक करने के बाद आप MS रेसिडेंसी में पढ़ोगे. The reason that they have a difference is like they practice. So ऐसा कुछ भी नहीं है, there is no difference. हाँ, yes, once your final prof is done, now you have to emphasize more on solving MCQs. So ये गलत आर्ट है कि फाइनल ईयर में you are giving 70% of your load to solving MCQs, thinking that, okay, I have to pass an exam. First of all, conceptualize it, read it, prepare it, and then appear for your university exam. Uske baad you have 1 year to just divert yourself now. Same content will fuel your NEET PG also, will fuel your university exams also.
Thank you, sir. Sir, you were telling us about the books. So, sir, many have a question that uh, in MBBS, what books should they follow for surgery, or are the lecture notes, whichever source they are following, are they enough for their professional exams as well as the competitive exams?
Let me tell you, I have a bit of biased approach in this. First of all, there is no one who can replace book, because try to understand, the lectures are always made in a way that we have a time bound concept. So हमें पता है कि in 60 hours or 80 hours we have to complete the lectures, and therefore I have to cut short the things. I will try to explain the things, but not beyond a scope. So remember, you cannot replace the textbook study. It has to be your base. Now, when we talk about the lectures, if you see the conventional lectures, they are framed in such a way that it is a point-based, you can say, learning. So जो लोगों को लगता है कि यार ऑनलाइन रिसोर्सेज से या जो इंस्टीट्यूट्स हैं जो थोड़ा बहुत करके पढ़ा रहे हैं, that's okay to polish you, but they cannot make your base. No, let me tell you one very important thing. Like if you talk about Surgery Dada also, that the app that I have, in that I have a NEET PG segment, but that NEET PG INI-CET segment is totally denoted in a way that, okay, someone knows the content, he or she wants to prepare it for NEET PG, and that is how the things are. But if someone will ask me, okay, is this sufficient for my everything? I would say no, it's sufficient for your exams. But to make a concept, to create, you can say, that volume in that subject, you have to have a textbook support. And that is why I have launched that all those books, like the bedside clinics and those algorithm based books. But yes, when I talk about my residency teaching, jo meri residency, that Dadagiri series 1 that I have taught surgery more than 140 hours, 140 घंटे, and still some part of GIT is left and some part of general surgery is left. Because that is the way. Surgery is vast. If you ask me to cover everything, it will take time. So not everyone has that time window. And that is why I said, start it early in the second year. Because if you start at that time, you'll find sufficient time to revise it again and again. बच्चे अगर आप कोई चीज रिवाइज नहीं कर सकते ना, is useless. So that is the time when you start mugging up or getting in those traps. Okay, I will go to, you can say, I will go to a conclave where they will have 5 days of revision of 19 subjects. I'll mug up that. And that is, again, you fall in more and more trap. So remember, no one can replace the textbooks. They are the crux. And when we talk about textbooks, students try to read Love and Bailey. It's a beautiful book, beautiful book. लेकिन वो यूजी के लिए है, वो पीजी के लिए नहीं है. सो लॉट ऑफ यू हैव अ, यू कैन से, मिथ ना कि लव एंड बेली इज इट फॉर पीजी स्टूडेंट्स. नो बच्चे, पीजी आज की डेट में कोई भी लव एंड बेली नहीं पढ़ता, डिस्पाइट द फैक्ट इट्स अ गुड बुक. सो स्टार्ट रीडिंग लव एंड बेली, एंड देन वट एवर ऐप यू आर प्रेफरिंग, किसी भी ऐप से पढ़ रहे हो, प्रिफर अ टीचर, चूज अ टीचर हु कैन एक्ट लाइक अ मेंटर. बच्चे, दिस इज अ राइट टाइम. ट्राई टू अंडरस्टैंड, मूव अवे फ्रॉम दैट निमोनिक बेस्ड लर्निंग. वो जो रटने का कॉन्सेप्ट है, मूव अवे, because you are destroying yourself. Delay your selection by 1 year. Remember, delay your selection by 1 year, but don't fall into that trap, because once you move out of the, you can say, this exam based regime, and when you complete your things, and if you don't have that confidence of concepts, your eyes will never see, your brain doesn't know, and that time you're seeing a patient and remembering the mnemonic. Oh my god, aise hoga, aise hoga, should I cut this first, that first? So there comes a difference in the confidence, and a patient will never get operated from a underconfident surgeon. This is the life, and that is why you start getting frustrated. You know, yaar, surgery is saturated, surgery is saturated. You must have seen everyone talking about surgery being saturated. ऐसा कुछ भी नहीं है. You know, I am young. I'm not that aged. I have 2 hospitals. I've made it in a city which is in Delhi. So I don't have any base in Delhi. My parents are from Kanpur. They're from UP, and I settled myself in tier 1 city, and that in a short span of time. So जो लोग कहते हैं ना कि saturation है, काबिलियत है, तो सारे saturation को फांद के आगे जाओगे, और काबिलियत नहीं. So you can say a bad workman always blames his tools. This is what is going to happen again and again, and you keep on blaming yourself. So start early and lead the race. This is what is my mantra.
Well said, sir. Sir, you were telling that books cannot replace the lectures. Sorry, lectures cannot replace the books. So, sir, you are telling to start the surgery early in the second half of second year, but many students who have not started surgery that early, they are starting it in their fourth year. Then many of them do not have time, means to study the book. So, what should they do?
Uh, First of all, like try to understand, we have to enmass the knowledge. Remember, एक word होती है ना, you have to enmass the knowledge. And how can you enmass the knowledge? Try to understand. Have you seen that movie Three Idiots? Oh, Rancho, huh? He used to sit in any class. He used to sit in every class. And from here and from there, he used to get that knowledge. So you skip the surgery postings. बहुत बड़ी चीज है. So when you go to surgery postings, and you are willing to learn, the surgeon will always teach you. Lekin you don't go and then once upon a time you just jump on the teacher, so wo nahi padayega. So identify good teachers in your institute, go to them, do a case presentation. That is the only way where you can reduce the learning curve by 1/4. Try to understand, either you learn on your own, start early, study well, try to mix the clinics and the techs together, take help of all the resources available near here and there. But if you haven't done till yet, go to the wards, learn from the experience of the others. So someone is giving you a case presentation of CA stomach, they'll tell you, okay, this will be the classical presentation. So now you know कि a patient of CA stomach lying in front of you, this is the classical early presentation, this is the clinical finding, and today I'll get back and read that case. So remember, common things are repeated, rare things are not repeated. Remember, the first thing to success is you should know the common. Because वहां जो foolishness होती है ना, that costs you life also, that costs you rank also. So start with the common case. Don't miss the ward postings. If you see the latest trend of, you can say, exam, I would say in last 5 years, whatever surgery-based questions if you see, or maybe last 10 years also, how many volume number-based questions have you seen? How many Hakataka syndromes have you seen? Lakataka syndromes. People are bothered. Now I see a lot of, you can say, online resources telling most common cancer in India, most common cancer in West Bengal, most common cancer in male in India, in female in India, most common. But see, this doesn't matter. If you see the surgery papers, they are made by surgeons, not by morons. I would say morons, don't take me otherwise. बच्चे ये जो competitive दुनिया अभी आप देख रहे हो, the education level has gone to an extreme low. First of all, lot of people who are teaching their subjects, they don't know what they are teaching because they don't practice that thing. And someone who's not practicing medicine or who's not practicing surgery, how can they teach that subject? That's the complexity. So that then you land up mugging up most common presentation, most common investigation of choice. Remember, the case differs. Let me share a common experience. 3 days before, I operated a retroperitoneal, you can say, tumor. And before that, I did, you can say, ultrasound, and ultrasound was showing me a complex cystic necrotic lesion. So I went for a CT. CT was showing me a non-enhancing with mild septate enhancement, no lipomatous component. So basically, अगर आप retroperitoneum की बात करें तो liposarcoma is one of a very common tumor. So everyone will have a view that, okay, it's a liposarcoma. But just see the level of, you can say, introspection I've done in that case. Patient with mild septal enhancement, that's a case maybe suggestive of paraganglioma. अब ये चीज अगर आपने पढ़ी नहीं होगी, so how will you get a metanephrine done? And then you will go on the table, you will operate on the patient. The moment you touch the tumor, the blood pressure will shoot and the patient will die in front of you without your error. And you will be taken to court, you will be sued. Why? Because you never knew anything. So यहाँ पर वो difference आता है कि learn the basics. So जब आप अपने colleges में ward postings में जाएंगे, वहां पर वो यही सारी चीजें सिखाते हैं. वहां आप देखो, वो they don't tell you the first surgeon to do this, second surgeon to do this, the first symptom is this, second, they will tell you the basic. This is the presentation complex, this is how we approach. So surgery is all about the mathematics based disciplined approach. Here we don't say 2 plus 2 is 22. Just like in microbiology, if it is, or in biochemistry, if you have a mousy odor from urine, so you'll have a mousy odor. You will not retrospect ki क्यों है mousy odor, fish like odor है तो क्यों है. But in surgery it's not like that. If there is, you can say, presentation, we have the reason behind that, everything. So that is why surgery is very precise. And if you are a final year subject, आपको लगता है यार सेकंड ईयर तो हमने उड़ा दिया मौत मस्ती करने में, सो बच्चे स्टार्ट फ्रॉम द वार्ड्स, जो भी केसेस वहां पर डिस्कस होते हैं, जॉट देम डाउन. ऐसा नहीं कि आज मैंने पढ़ा और मैं भूल गया. जॉट देम डाउन इन अ डायरी. Whatever case is discussed, go back, open your books, fill up the blanks. कि ठीक है, ये आज मैंने CA breast का केस देखा, so I remember the CA breast staging, I'll remember the CA breast approach, I'll remember the triple assessment, I'll remember the management, or I'll create my own notes so that I can revise it again and again. And this is how you'll master in everything. So यही एक तरीका है कि फाइनल ईयर में आप अच्छे से you can excel your things, because half of your efforts and half of the efforts of the consultants who are going to help you with this.
Thank you, sir. So we all know.
Skip the word. Yeah,
Okay, so we all know that wards and internship, they are very important for surgery. So, sir, according to you, how will we utilize them?
let me tell you. So when we talk about wards and when we talk about the internship, first of all, in wards, you don't get to access emergency. So wards are the time where you learn about cold cases, and especially when you talk about yourself, like MBBS students, उनको सबसे ज्यादा क्या जरूरत होती है? उनको सबसे ज्यादा जरूरत है approach to SOLs. So how to approach a swelling, how to approach a lump, how to approach intestinal obstruction, how to approach, you can say, the basic standard cases like thyroid breast. If you have a base of thyroid breast made in the ward, it will be very easy to learn them when you read the textbook. आप क्या करते हो? टेक्स्ट बुक पढ़ते हो, वार्ड करते नहीं हो, you go for an exam and then you are confused. So surgery is all about practicing. If you practice that thing, you learn that thing, you will excel. Otherwise बच्चे आप घूमते रहोगे. So ward will tell you about the cold cases. Now when you come to internship, now when you talk about surgery, the best part to learn surgery is either the OT or the emergency. So in the emergency, you get the first approach to the trauma, and everyone will agree to this. हर एग्जाम में 7 से 8 क्वेश्चन ट्रॉमा के आते हैं. Why they don't want to test my knowledge? They want to test your knowledge. People say नहीं, trauma important. Trauma क्यों नहीं important होगा? They are organizing a competitive exam for you guys. And remember, when they are organizing a competitive exam for you guys, they know that what you have been exposed to. So trauma is the part, burn is the part which you access in the emergency. Obstructions you get in the emergency. Bleedings you get in the emergency. बहुत सारे बच्चे कहते हैं कि सर आप बड़ा अनकन्वेंशनल वे में पढ़ाते हो. आई स्टार्ट द जीआईटी विद जीआई ब्लीड एंड द नेक्स्ट चैप्टर इज इंटेस्टाइनल ऑब्स्ट्रक्शन. Study the subject as a subject comes to you. The patient will come to me with bleeding. So it may be esophageal, it may be a gastric cause, it may be a portal hypertension. There I will summarize this and everything. So try to make that learning associative learning. When you get a patient in emergency, so suppose you get a retroperitoneal injury, or suppose you get a intestinal injury, you get a liver trauma, उसको वहीं पर पढ़ो जरूर. So once you settle the, इसका मतलब ये नहीं कि once a patient comes, you start opening the notes and patient is dying, Dr. Babu, bachinin, and you are just busy learning. No, the first is stabilize that patient. Now you have that freedom of having the resources available on your phone. अपने फोन में पढ़ो, देखो क्या important चीजें होती हैं और उनको वहां देखो. So remember, you have that associative memory, you have that memory that you practice on that patient, and that creates an impact. Are you getting me? So छोटे जब हम, when we were kids, there was a subject which was known as moral science. So moral science में last में एक moral बताते थे. The moral of the story is united we stand, divided we fall. But to explain that moral, they created that 10-minute story which you were forced to read. Do you know why? This is known as the power of association. फिर वो अगली बार याद रहेगी कि there was a swarm of birds and one of them separated in hunt of that, and then he got caught by that poacher. So moral of the story is stay with your friends, stay. So ये समझो इस चीज को. So next time when you get the patients in emergency, do assess them. Do see what is written in my books and can I get it in my, and try to catch hold of third year PGT. First year वाले से कोई फायदा नहीं होगा, उसको बेचारे को कुछ नहीं आता है, or he's struggling with his life and sleep. So try to catch hold of third year PG who are ready to teach you also and who are loaded with the knowledge. The maximum knowledge is available with third year PG, because उसके बाद again you are stuck in that cycle. So वो आपको कुछ अच्छी चीजें बताएगा, उससे केस डिस्कस करोगे, so you will hurt his ego. That that an intern is asking me a question, trying to explain me something, and in that retrospective, you can say rebound to that ego, he will tell you, okay, you know, you are talking about this liver trauma. Do you know about this uh, concept of packing? Do you know damage control surgery? And then that is what you wanted. You wanted to provoke his ego. And now in that provocation, he taught you 2-3 things. So आ गया ना वो रैंचो कॉन्सेप्ट, आपने उसे प्रोवोक किया और उसने फिर वाह, आपको वो 2-3 चीजें थी आपने नोट कर ली. So this is how you get access to the best available resources in free and in purest form.
Thank you, sir. So many students, they are now in their internship or they are post interns. So for them, what would you suggest when how they can revise the surgery for the competitive exams?
देखो, when we talk about the interns and the post interns, now you know that exam तो देना ही देना है until up till the day the next is declared. Let us presume that this is the system which shall be going on. So first of all, you have to decide how much quantum of your day you are devoting to study. आपने decide करना है कि जी मैं 5 घंटे देने हैं कि 10 घंटे, वो and beyond that all those things are hypothetical. आप कहते नहीं जी I will study 20 hours a day, बच्चे नहीं, your brain will not be able to concentrate beyond 10 hours, 10 effective hours. So if you decide that 10 hours a day, follow the 70-30 rule. What is the 70-30 rule? 70% of your dedicated time should go in reading theory and 30% of that time should go in solving MCQs. Why? Because now you don't have to write the answer. You have to write the explanation to that answer. Okay, it's option A, it's option B, it's option C, or option D. So they have the explanation. You have to match that thing. So 30% of the time should go in solving MCQs. Now 70% of the time that you have, you should again have a split of 1:2. Now you will say, sir, what it is 1:2? Remember, 70% of the time you have dedicated for theory. Suppose you decide that I will study for 8 hours. Of this, 5.5 hours of mine will be going to the theory part, and remaining 2.5 hours will be going to lecture, to this, what you say, MCQs. अब ये जो 5-5.5 घंटे, that should be divided as 1:2. What is 1:2? 1 major subject, 2 minor subjects. जब तक next नहीं आ रहा है, ये मान के चलना है. 1 major subject, 2 minor subjects. So now 70% of that time should be devoted. Again, 70% of that time should be devoted to study 1 major subject, and 30% of the time should be devoted to read 2 minor subjects. Remember to be a fast reader. So suppose 5 hours you have, 4 hours you will study the main subject. So you decided, okay, I'll be completing medicine. So you'll be studying medicine. And then you decided, okay, short subjects, I will pick up one dermatology for 30 minutes and 30 minutes radiology. Once the timer clocks 30, stop dermatology or stop whatever short subject you are and switch to the other. But this way, your brain is getting adapted to the multiple subject-based, you can say, approach. Because when you're going for exam, you don't get all the questions from medicine, all the questions from surgery. So first of all, you're doing a lot of twisting. कि मैं एक दिन में I'm studying a major subject also, I'm studying 2 minor subject also. First of all, you learn this. The second thing is that the short subjects, the beauty that they have, they're really very short. The first reading might take maybe 6 hours to complete, cumulative I'm talking. The second reading might take only 30, you can say 3 or 4 hours to revise them. And when you're going for exam, ऐसा आएगा कि in 30 minutes you can revise the entire subject. So this way, you are just consolidating, zipping off all the large, you can say, short subjects into a very short span of time, without having to worry about कि मैंने anesthesia तो पढ़ी नहीं, मैंने psychiatry तो पढ़ी नहीं, dermatology तो पढ़ी नहीं, या orthopedics तो पढ़ी नहीं. So remember, major subject should be given that respected time, क्योंकि इनमें concept building बहुत जरूरी है. So whatever videos you are looking, whatever text you are reading, वो आपका 70-30 split में होना चाहिए, and 2:1. That's 1 major to 2. Again, the next thing is what you all do a mistake is, आज मैंने esophagus पढ़ा और शाम को मैंने दंदनाता हुआ esophagus के 200 MCQs I solved. Now, when you solve 200 MCQs of esophagus, you get a pseudo boost. My God, I'm great. I'm GOAT. Greatest of all time. सारे सही हो रहे हैं, बच्चे होंगे ही होंगे. And if you ask me, sir, what is the probability of me getting selected? I would say only 10%. You are doing a wrong exercise. Today, if you study, suppose a subject surgery, and you are studying, suppose esophagus, agle hafte solve the MCQs, or maybe at least 5 days gap. You need to get some time to settle down. Suppose if you are pouring a cold drink into a glass, there will be a time when the liquid is less, but the effervescence is very high. है ना? So total gas, and you are getting, you can say, a belief that okay, I have this glass full. Wait for 10 seconds, and then you see it's only 40% of the glass which is full, and 60% to gas होके हवा. समझे कि नहीं? So slowly and slowly pour your knowledge, and then taste it, or test it. Are you getting me? So बच्चे, ये बड़ा important concept है कि take one major, two minor subjects. The second thing that you have is that split of 70 and 30. The next thing that we all need to understand is the value of time. So mention what you did. So whenever you are going to sleep, suppose you decided, okay, I'll sleep around 10 p.m. or 11 p.m. Remember, spare 5 minutes to talk to yourself what you did throughout the day. Bache, you should be able to judge your character. You don't have to show your competency to anyone. You should be truthful to yourself. You should write it down that today I wasted this much of amount of time. Today I was not able to cope up with this much amount of time. So this is how the things are. Very, 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 very important. Are you getting me? So this is the most important thing. So when you start writing everything that, okay, I did this, I did that, you become accustomed to that habit, and you know that, okay, I'm wasting my time. जब आप लिखते नहीं हो ना, अरे फर्क क्या पड़ता है, बहुत फर्क पड़ता है. In the later phase of your life, you will realize. So this is very important mantra for everyone. Everyone.
Thank you, sir, for your valuable advice. Sir, now keeping the academics part inside, those who are aspiring to be a surgeon in future, so sir, can you tell how it is actually to be a surgeon?
Oh, how you? Can you pardon? Can you repeat it? How?
Sir, those who are aspiring to be a surgeon, can you tell how it is actually to be a surgeon?
Okay, okay. I'll tell. And I've also, sir, Utkarsh has written one question also. But sir, it's true that residency of surgery is toxic. I'll respond to both of your queries in this only. Just looking at the question. But say, first of all, surgery is not by chance. It is always by choice. It is always by choice. So first of all, you have to develop that zeal that I want to be a surgeon. Why most of you are confused? Because you get a very late exposure to this branch. So you get to see the exposure maybe in the second half of the final year. Some people start going to work from the first day of the final year, but before that, very few people have that exposure. So first of all, when you start early, when you start reading, you start nurturing your brain that, okay, this is a wonderful subject, I love this, but I don't know about this. So this is just like one-sided blind love. You are thinking that, okay, I'll be going for this subject. Then when you go and see the ward, you understand the plight of the patients they came with. So yesterday this patient was crying in pain because of acute obstruction, and today, my God, he's relieved. बच्चे, आप कुछ भी कह लो, residents may be cursing the consultants, or you people might be cursing the consultants कि ये इतना खराब है, इतना टॉक्सिक है, ये है, वो है. Go and ask a patient. If you get a, you can say, software to analyze a patient's heart, when a surgeon is standing post surgery, he's only blessing him. God give him great life. God give him everything. God give him everything. ये सिर्फ और सिर्फ सर्जरी में मिलती है. That flamboyancy, that swag that a surgeon carries is just because of the work he does. मजा आता है, मजा आता है. कहते ना, वो रेसिडेंसी में पहले मजबूरी में कर रहे थे, अब मजा आ रहा है. वो मिर्जापुर का एक डायलॉग है ना, गुड्डू भैया सेट है ना, पहले मजबूरी में करी. So when you are in the residency, yeah, I understand it's very toxic, but you need to learn that toxicity. Because if you are not exposed to that toxicity, you will not understand the value of human life. A lot of people say, very बहुत toxic है, बहुत toxic है. Do you know you are handling life? It is not a medicine. If you talk about, don't take me about that. मैं थोड़ा सर्जन और मेडिसिन वालों का थोड़ा सा चलता है रहता है. बच्चे, मेडिसिन में क्या है? एक विटामिन बी खिला दिया, विटामिन डी खिला दिया, कैल्शियम खिला दिया, भैया एंटीबायोटिक खिला दिया. अच्छे हुए तो हुए, नहीं अच्छे तो नहीं हुए. दवा रिएक्ट कर गई तो मुंह पूरा फूल गया, बस एंजियोएडिमा अनासार का यही तो होता है इन सर्जरी. Once you make an incision, you cannot say no, 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 I'll rub this incision, I'll make it here. So you need to learn that accountability, and that is why toxicity is there. A small mistake and you will not be given a scalpel for next 30 days. And yes, I admit this thing, and this should be done, because you should learn the value of a human life. Today it is a patient, tomorrow it could be your relative, or it could be you on that bed. And imagine the person who's handling you is thinking about anything else. And that is why surgeons are mad. वो कहते हैं ना, वो पागलपन, जुनून जुनून चाहिए इस ब्रांच को लेने के लिए और करने के लिए. टू परस्यू दिस ब्रांच यू हैव टू बी मैडली इन लव. कोई नहीं होता एक सर्जन के लिए. उसकी पहली मोहब्बत, उसकी आखिरी मोहब्बत उसकी ब्रांच होती है, उसका पेशेंट होता है. You know, when you have that thing, you have that valor, then only you will be able to operate. So it's very important to make you go through that toxicity, because if you don't go through that toxicity, you will never learn the importance of human life. I also scold my doctor. I also scold my, you can say, staff every day. I scold my doctors every day, but they know that a man that who is scolding me will make us great, and that is why they accept that with all pride and valor. Okay, sir is saying we will accept this. I rip them apart even if there is a small mistake. Do you know why? Because in surgery, a small mistake or a big mistake will equate to a life. जैसे आप कभी भी you cannot fill up with this a word sorry. I'm sorry. Can you understand a surgeon coming out and saying, I'm sorry? What does that mean? The moment the surgeon says this, now there's a silence. Oh my God, we have lost. So this is what is very true. So Mysore has written, surgeons are morons, but they are not poor. Are actually, this is true. Let me tell you, when we talk about surgery, as you can say on the monetary side, this is one very simple thing. If you are passionate about any medical branch, you will always do the best. Take it a rule. Yes, surgical branches are high rewarding. Why? I don't need to see 10 patients a day. I have an OPD of only 4 and 5. And I operated on a patient, he will fetch me 50-60,000. So one patient equated in time, if you see, I spent 15-20 minutes counseling that patient, took that patient for surgery next day. So yes, it is rewarding, but the reward will come only when you're passionate. So remember, when you talk about money in this branch, the day you are thinking about money as the primary factor to drive you in this branch, you'll never be able to succeed. बच्चे पैसा तो आएगा ही आएगा, काम करोगे तो पैसा तो लोगे. You are professional, you'll earn money, you'll earn everything. But the first thing that you need to understand is you have to have that empathy for the, you can say, patient. You have to have that passion कि रात में 2 बजे भी आए तो आप ऑपरेट करो. Let me tell you a small example. I returned back from Kolkata midnight. I was too tired because I took the early morning flight to Calcutta yesterday, and I returned back yesterday around 1 a.m. And morning 6:30, I was fresh. Why? Because I had a case to operate. So this is that drive, that passion. So इतनी मेहनत करेगी तो पैसा तो यार अपने आप ही आएगा. And surgeons even don't count the money. वो अपने आप ही एक टाइम के बाद इतना होता है कि you just enjoy your things, है ना? That is what. So don't think about money. Any branch. Suppose if you go for a paraclinical branch also, or suppose if you go for a you can say branch like biochemistry and physiology also, and if you're passionate, you'll go into research. You'll get name, fame, money, everything. You'll be a laureate. You'll be a great researcher. You'll make a new discovery because you're passionate. तो हर branch में पैसा है. But medical field, if you have opted this medical field for the sake of money, बच्चे, this is wrong. फिर तो आपको फाइनेंस लेना चाहिए था, and you should have started to do some trading in the stock market, because वो ज़्यादा rewarding है. Medical field is all about satisfaction and gratification. So beyond a limit, no one can earn money. Don't think me. If you take me as a surgeon, I am a middle class. If you think I'm a businessman, I'm running hospitals, then only I'm rich. So it is the businessman who makes the money, not the doctors, because doctors don't have a prime, you can say, aim or motivation to earn money. They have the motivation to service. So when I'm sitting on this chair, I'm a consultant. So I'm doing my job, I'm not earning. But as a, you can say, owner of a setup, of course, there are other perks that comes into. So पैसे के बारे में मत सोचो. Think about, yes, you are following your branch, you're following your passion, and there, do you know, only 10% of people in life, 10%, they have the chance to fall in love with their work. Only 10%. तभी तो देखो, like people look for other activities like hobbies, like photo, they click photos, they watch a bird for 20 minutes and wait for the ideal pose and they click that, क्योंकि वो उसको happiness देता है. Some people go on mountain for hiking, this and that. उनकी पैरेलल पैशंस है. बच्चे मेरे से पूछो, कुछ नहीं. आई ऑल्सो ट्राइड अ लॉट. आई बॉट अ कैमरा, मेरे से फोटो नहीं खींची बिकॉज आई डोंट हैव दैट मच ऑफ टाइम. किया ठीक है, कौन करेगा यार, एक फोन से फोटो खींच ली बस, बढ़िया है. आई ब्रॉट दैट GoPro, started making blogs. For me, those blogs are without any flavor. I prefer to make a raw blog of my surgery OT when I'm operating and I'm talking casually. So अपने को इसी में मजा आ रहा है. कोई पैरेलल कोई चाहिए ही नहीं, मोटिवेशन कोई कोलैटरल चाहिए नहीं, इसी में इतना नशा है. आई एम नॉट गेटिंग आउट ऑफ दैट. एवरी डे आई एम इंजेक्टिंग माई सेल्फ विद दैट वन मोर केस ऑफ सर्जरी. यस, इफ आई डोंट गेट अ सर्जरी, आई एम द वन हु इज गेटिंग ट्रेमर. सो वो जो दीवानापन है ना, वो होना चाहिए, वन साइडेड लव. एंड देन यू विल सी that this branch will play with you and you will play with this branch. Every day you will have that smile and the patients will pray that, okay, this doctor lives long.
Well said, sir. Sir, those who are means want to make career in surgery, so what are the study options they have for the study options?
When you talk about the specialty and the super specialty, are you talking about?
Yes,
Okay,
yes.
so this is a big question that when you are talking about, Utkarsh, I'll take your question later. I'll answer this question first. So I'm parallel, I've opened the chat box also so that I can answer. I don't miss the questions of the students. So when we talk about surgery as a career, you need to understand where you want to settle and what you want. Suppose you want to settle in a tier 1 city. So if you want to settle in Delhi, Mumbai, Bangalore, Hyderabad, Chennai, Kolkata, these are tier 1 cities. You need to do your super specialization because otherwise it becomes very tough, because in these cities, opening up your own center, it's quite costly, and most of the people uh, come from a humble background like me. It becomes very difficult, very difficult. So वहां पर super specialty is very important. Why? Because then you get a at least a minimum level of access to a corporate hospital where you have a minimum level of job security. But suppose on the other side, you want to open up your hospital. You have decided, okay, I will run my own setup. So how can you be a super specialist and you run your own hospital? You are a neurosurgeon. You will not be able to run your hospital as a general, because then you will have to hire the other teams. And that is the time when the system goes wrong. So a general surgeon can run a hospital, but it would be very difficult for a neurosurgeon to run a super specialty hospital. For instance, for a gastro surgeon, he can open his single specialty unit. That is a different thing. So first of all, you need to decide where you have to study, where you have to settle. The second thing is, when you are planning this thing, you should try to choose that city, if it is available, as your center for PG also. Why? Because people don't know. Try to understand and play with the mindset of people. The more, if you talk about the advertisement, how these advertisement play. So social media, everywhere you go, you see one ad, you see one brand, and then you start developing conviction. Every day वो brand आपके सामने flash कर रहा है, तो आप धीरे 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 convicted हो जाते हैं. And one fine day you wanted to buy a t-shirt and you know, okay, Sarji Dada is a brand who is manufacturing good t-shirts, I'll buy from that. So when you are doing your residency, suppose in Kolkata, and you want to settle in Kolkata, everyone near around you is seeing you practicing as a surgeon. They don't know whether you are studying surgery or no. They know that you are a surgeon, and for 3 years they are acclimatized seeing you in that role. And when you actually step in Kolkata, or maybe for instance you completed it in Delhi and you settle in Delhi, you have that 3 year advantage of the virtual or physical presence that you created. तो ये एक बड़ा इंपॉर्टेंट सा रोल होता है. हम इसे भूल जाते हैं. हम यूजी कहीं करते हैं, पीजी कहीं और करने जाते हैं, सुपर स्पेशलिटी कहीं और करते हैं, एसआरशिप कहीं और करते हैं. By the time we are 35, 36 and then decide, okay, I'll return back to my hometown. So difficulty तो लगेगी. जब 37 years में आओगे, you will find that ego also, because at that age you are married also, expenses also. तो तुम्हें लगेगा कि यार, you will feel like, okay, it's highly saturated. So the word saturation is retrospective. So you need to decide what you want to do, where you want to do. Okay, I've done MS, I'll do some fellowships and start doing my work. ऐसा तो नहीं है कि you will not get work. If you see the doctor is to patient ratio in India, it is horrible. Next to Africa, basically, इतने डॉक्टर है नहीं. Now you'll say, sir, इतने सारे हर साल लाखों लाख डॉक्टर क्रिएट हो रहे हैं. You know, most of the doctors don't stay in India. Thankful to the government, thankful to the conditions, the tough competition which the corporates eliminate. You know, small segment hospitals तो खत्म होते जा रहे हैं. It's the corporate hospitals. So rather than working in a corporate hospital and getting exploited in India, they're going to Dubai, they're going to Middle East, they're going to Australia, where they're having a better life also. So पढ़ते इंडिया में, ऐश बाहर करते हैं. ये एक सिनेरियो बनता जा रहा है. And that is why new generation surgeons are not available in India. Most of them are getting settled outside. So एक ये क्वेश्चन भी बहुत आता है कि सर मुझे इंडिया में सेटल होना है. How to settle in India? But I want to complete my residency or fellowships in outside India. पहली बात है भैया, इंडिया है तो इंडियन की तरह बिहेव करो. समझे कि नहीं? यहाँ स्टिल यू नीड अ वाटर जेट इन वॉशरूम. वो टिश्यू से काम नहीं चलता. सो सेम वे इफ यू डू MRCS और इफ यू डू USMLE एंड कम बैक टू इंडिया, यहाँ काम नहीं चलेगा. इंडिया में रहना है तो MSc मांगता है. इंडिया के बाहर जाना है तो MS नहीं मांगता है. पहले ही डिसाइड कर लो कि यस आई विल प्रेफर यू फॉर USMLE एंड गो आउट. सो डोंट बी दैट कंफ्यूज चैप. If you want to settle in US, the right time is this. अभी USMLE click करो, निकल जाओ. You want to go to Australia, go right now. You want to go to US, lab clear करो, निकल जाओ. हाँ, US को छोड़ के बाकी countries में if you want to settle as a surgeon, you don't have to give very tough exams. Like in Australia, you don't have to give us, if you're a specialist, you don't have to give a residency exam. You just have to follow their guidelines for 1 year and they have that training program. After that, you can start. So ये बहुत important है कि where you want to work, and that is how the things are decided. I'll take one more question from Price. Is this rumor is correct that Indian surgeons are underrated and they will not be able to earn money till 35 years of his or her life? Okay. Prayas, let me tell you. अभी मैं आपको exception देता हूँ. I'm only 35 years of age. I'm into my 36th year. And I have a multi-million portfolio. So ये सब कहने की बातें हैं. समझे कि नहीं? 35 years में ये नहीं हो पाएगा, वो नहीं हो पाएगा. क्या नहीं है? I have 2 hospitals under me. I have a good life. I have good cars. I have good life. I have good vacation. और क्या चाहिए? तो ये सब फालतू की बातें हैं. ये सब demotivate करने की बात है. If you are passionate about things, no one can stop you. Do you think I am immortal? I will also retire after some point of time. Then the others will enjoy that privilege. So no one is indispensable. ये सारी चीजें इसलिए बनाई जाती हैं ताकि you get demotivated at your early stage and then you start understanding, okay, this is my fate. I have to follow this, you can say, circle. कि नहीं, पहले मुझे ये unconventional way में this is accepted. I don't have to work hard. Slowly and slowly I will be pushed and at around 65 years of age I will also be earning. ये सब फालतू की बातें हैं. You should have that burning desire. If I can do, everyone can do. You know, I came to Delhi just to prove this thing wrong. I could have settled in my hometown in Kanpur also and done good, great rather. But I came to Delhi because people used to destroy my ego. They say, okay, Delhi, you don't have any, or you, for instance, Chennai or for Hyderabad, when you don't have any place to get you supported, how can you settle as a doctor there? Yeah, this is true. But if you have the skill, everyone will come to you. Everyone will come to you. I operate on patients from Africa. Recently, I've operated one Israeli scientist. आ रहे सब आ रहे. Today, I got a patient from YouTube. Thankful. आपको पढ़ाते भी हैं. एक patient भी आया, sir, seeing my video. Okay, sir, we want to get operated from you. So this is all myth and rumors. आप बहुत छोटे हो भी. You all are young and enjoy that vigor. बच्चे, आपको कोई defeat नहीं कर सकता. You don't have responsibilities. You don't have liabilities, and this is the right time to press the pedal hard. You can take up all those challenges. Late night, मेरे को कोई, suppose I'm in my hospital, that's a different thing. But if someone calls me in the middle of the night, sir, एक appendix करोगे आके क्या? So young surgeons will go, and that is the time you'll make the connections with the patients. So in the early phase, it is you who can choose. Would you be successful or no? Sayed, I'll take your question. I want to take CTVS. It is said that the entire branch तो बंद हो जाए. अरे कौन कह रहा है? Let me tell you, in CTVS, you do stenting? Yes or no? Everyone does a stenting. Stents have a वो counsel करते हैं कि stents have a life of only 5 or 6 odd years. And if you are a young patient, they always counsel that go for a bypass. But see, CTVS is a glamorous branch which will never fade. कभी भी नहीं फेड करेगी. हाँ, दिक्कत ये है, you have to have a burning desire to practice CTVS because the surgery are long haul surgeries. The second is like lot of emergencies post, you can say surgery also, you have to take a lot of care of the patient. So patient dependency on doctor is quite high, and that is why people are avoiding CTVS. ऐसा कहीं नहीं है कि CTVS is underrated branch. Rather, let me tell you the real statistics of Delhi. I'll tell you. Same goes with other cities also. When you do MCH gastro or DM gastro, you get a starting of 1.8 lakhs in Delhi right now. Just pass out, fresher. And after 3-4 years, you get around 2.5 lakhs, 3 lakhs, depending upon where you are. वो बढ़ता जाता है. But do you know CTVS की ऐसी shortage हुई है कि CTVS surgeons, even the new pass out, they are paid 4 lakhs, 5 lakhs also right now because है ही नहीं CTVS. लोगों ने कर करके वो सैनिटाइजर इफेक्ट क्रिएट कर दिया. एनीथिंग लुकिंग ब्लू विल बी सोल्ड एज सैनिटाइजर. तो राइट नाउ दिस इज वो सब फालतू की बातें कि CTVS इज सैचुरेटेड. बच्चे, क्या ह्यूमन इवोल्यूशन बंद हो जाएगा? आर वी गोइंग टू एक्चुअली बिलीव दैट ओके देयर विल बी नो मोर न्यू बर्थ्स, सो नो मोर ह्यूमंस, no more patients, no more tragedies, no more diseases? Yes, you have to become smart. That along with the time, you need to integrate the latest cutting edge technologies because patient will be opting for that only. So if you are old, rather मुझे तो ये बोलना चाहिए कि हाँ, जो लोग 35 की बजाय जो लोग 80 65-70 ईयर सर्जन है, उनका रिटायरमेंट खत्म, उनकी लाइफ खत्म है. क्यों? दे आर नॉट अपडेटेड विद द लेटेस्ट टेक्नोलॉजी. और यही एक चीज है. सो ये सब फालतू की बातें, सैचुरेटेड है, पैसा नहीं होता है, ये नहीं होता है. दादा को देखो, आई एम सेटिंग एन एग्जाम्पल. मैं पढ़ाता भी हूँ, काम भी करता हूँ. वो आई एम नॉट दैट मास्टर, हेड मास्टर लेवल सर्जन. आई डू सर्जरी, आई एम पैशनेट अबाउट दैट. माई सेमिनार इज गोइंग ऑन एंड 2 पेशेंट्स आर वेटिंग आउटसाइड. दिस इज द स्वैग एंड दे विल नॉट गो. उन्हें मेरे को ही दिखाना है. दे नो दैट okay, this is normal. If you want to meet him, you have to wait. तो सर कुछ नहीं है बच्चे, ब्रांड वैल्यू बनाओ. ब्रांडिंग इज मोर इंपॉर्टेंट देन एनीथिंग. You know what is the difference between Mercedes, BMW or a normal Maruti? In Maruti, you look at the cost is to the product. कि यार ठीक है, 5 lakhs में I'm getting a car with a cabin, with steering, with AC and with ये this and that. When you talk about Mercedes or BMW, that's an emotion. So they sell emotion because of their brand value. That is where the things are. You getting me? So surgery is not saturated at all. It's the most wonderful branch you can even think of.
Thank you, sir, for your wonderful words. I hope everyone got motivated hearing you. So,
Thank you.
sir, you were telling that those who have registered for this seminar will get some free material. So, can you tell how can they
Yeah.
access that? When you were
So
asking.
all the we have that data of all the students, and we will generate a code. So I'll share it to you people. So that code will be active, and anyone who can put. So it was like 100 students will get that access code, but anyone who will use that code, it's valid for 24 hours. Will personally text the students also that code so they can get themselves registered and they can access the free PDF or e-book of that signs and syndromes, clinical signs and syndromes. And do check out the content on Surgery Dada app. It's a wonderful app. It's having everything. It's a one-stop solution to everything that you need. We have a surgical video library with more than 130 videos. We have the Q banks, we have pro level, we have basic level Q banks, we have test series, we have PYQs, we have rapid revision, we have image based revisions. Everything is there. And the best part is that I take live classes on that. It's not a conventional platform. It's a very unconventional platform where the next batch is starting from 15th of July. So I'll again be starting surgery. You can say every day I'll be coming around 8:30 to 9. It's not that you can mug up surgery. So when you are studying surgery live from me, you'll understand because you have that feel. Okay, we are live. You have a problem, you'll type in the chat box and I'll clear it out. So बच्चे वो एक अलग ही मजा है. So do go to Surgery Dada, do check out, and the best part of Surgery Dada, you can also access via web. So आप टीवी पे चलाओ, कहीं भी चलाओ, it's good. It's the only platform which has no bakwas. 100% motivation, and remember the motivation that you people need is core surgery, surgery, surgery. Anything less than that, वो आपके लिए बेकार है. Lot of people say ये करो, वो करो, बच्चा वो. अरे बच्चे बच्चे नहीं हो यार तुम लोग. बच्चे पैदा करने की उम्र है तुम्हारी. तो वो सब छोड़ो. You don't stop treating you people like the kids. You need a real motivation, and that motivation is the core clinical things. Remember, this is what is very important. So वो जो पैम्परिंग है ना इंस्टीट्यूट्स की, लोगों की पैम्परिंग, जनरेटिंग दैट शोबिज इज यूजलेस. अंडरस्टैंड, पीछे आग लगी हुई है और नहीं बुझाई तो फट जाएगा बम. आर यू गेटिंग मी? So this is what is really very important. Every passing minute you understand, the minute that you waste, someone is bypassing you. वो कहते हैं ना, वीरू सहस्त्र बुद्धि said life is a race. Yes, life is a race. You'll realize when you lose that race. अभी तो you're not having that feel. बाहर निकलो तब समझ में आएगा कि यार वो टाइम थोड़ा सा मैनेज कर लेते ना तो कुछ और लगा होता. तो दिस इज व्हाट इज वेरी इंपॉर्टेंट. Remain conceptual. If you stop wasting your time, you have sufficient time to develop concepts. आपको ये रटने वटने के, ये रटनों वटनों के सेशंस अटेंड करने की जरूरत नहीं है बच्चे. Learn the basic concepts, go to ward, read good books, and for any other thing, Dada is here for you. So do register yourself on the app and claim your, you can put the coupon code. So someone from our team will also share, you can share the number of the responsible person from our team. So he or she will help you with that free subscription of our ebook. There are other books also you can check out. You can always check out the lectures, contents, and we have a lot of offers going on. So
Yes, sir.
especially for the MBBS.
Yes, I would like to interrupt,
Yeah,
sir. So you were telling that there are some offers for the students going on in your app. So can you tell everyone about
yeah.
that?
So let me tell you, there are two things. Like any student who is going to get who is going to buy the Surgery Dada subscription. So currently it was planned that post NEET-PG exam we would increase the costing to 3,500. It is currently 2,999, very less than one pair of denim that you actually one pair of clothes that you actually spend for. So it's very cheap. On that also we are offering some discounts using the codes. Along with that, I would gift you all the subscription of my ebook. So Surgery Dada Basics of Level 1. So that ebook subscription will be complimentary. Along with that, I have you can say sponsorship for you all. There's a platform known as GAME, Global Academy of Medical Education. It's not a very, you can say, flamboyant platform, but a sober platform with good teachers, and that is having all 19 subjects with at least 20,000 plus questions, at least thousands of, you can say, test series, and a good study material. Anyone who is going to purchase Surgery Dada, for you all who have attended the conference, you will get the subscription of GAME, all 19 subjects, QBank, study material, everything at 199. So don't think that it's a trap. We all want that, the GAME people want that you should actually get an access. So you should learn. वो FOMO आपके अंदर से जाए, that FOMO someone has created, okay, XY app, you have to purchase. This is now the new religion. This is now the new rule. No, बच्चे दो. So at least you can spare that 199, and that will be only available if you are complementing it with Surgery Dada. So Surgery Dada, do try it all. We have lot of, you can say, rapid revision programs. And again, my offline classes coming. I'm starting with my offline class in Delhi. Also, I'm planning it for Kolkata also. So I'll update about the Kolkata chapter. I think I would be conducting it in September. So anyone who has purchased my online subscription will get a discount in the offline also, or if they purchase my offline, they will be getting a rapid revision complimentary for that. So any students from any question from the audience also, I would like to you can unmute and ask your question.
Good evening, sir.
Good evening, good evening, good evening, Rishabh.
Dr. Rishabh this side, sir. 19 batch intern right now.
Yeah, Rishabh. Yeah, tell me.
Sir, the thing is that, I am preparing for NEET PG from a long time. But the thing is, sir, with time the resources have increased. Many institutions have came and it's, creating problems for the students here ki to whom to choose. Someone is recommending someone is recommending other one. And basically, sir, the thing is कि at last we feel कि यार एक FOMO होता है ना कि सर जी
हाँ
दादा से नहीं पढ़ा तो ये छूट जाएगा, वहां से नहीं पढ़ा तो ये छूट जाएगा. तो सर recently I have purchased your rapid revision course. And sir, the thing is कि you are right कि concepts are very important, but certain things are like, sir, जो रटने ही पड़ते हैं, like staging.
हाँ
Staging is very critical thing, sir. Then even, sir, I started with the general surgery, and in that, sir, I found that there are many tables. The shock की table है, sir. ठीक है, and there are certain percentages too. There is certain staging. तो सर वो चीजें तो हमेशा से याद ही करनी पड़ती है.
नहीं देखो मैं एक चीज बताता हूँ लाइक इफ यू टॉक अबाउट स्टेजिंग CA breast you have to remember that less than 2 2 to 5 more than 5 same is the staging for the cancer of the anus also so वो थोड़ा थोड़ा मिमिक करते हैं हेड एंड नेक में एक स्टेजिंग चलती है जीआईटी में पूरी जीआईटी में एक ही स्टेजिंग है डू यू नो द T1A is into the mucosa T1B submucosa T2 is into muscle so वो आपको लगता है ना रटने वाली बात है इतना तो समझना ही पड़ेगा रही बात शॉक की तो शॉक में ऐसा कोई रटना नहीं पूरी सर्जरी में एक ही टेबल है जिसमें टेनिस का स्कोर याद रखना होता है 15 to 30 more than 30 up to 45 तो दिस इज वेरी सिंपल वो बहुत ज्यादा रटने वाली चीजें नहीं है बेटा बड़ी बेसिक है अब रही बात फ्लूइड्स की यू विल हैव टू रिमेंबर ना 150-20 और 4-2-1 तो थोड़ा बहुत तो करना ही पड़ता है पर अब इसके लिए बहुत ज्यादा निमोनिक्स की जरूरत नहीं है सिर्फ इतना ही रटना है बाकी सारी चीजें बेसिक्स है इट्स वेरी इजी ट्रेक माई वर्ड्स इट्स वेरी इजी रही बात फोमो की तो फोमो मत बनाओ देखो एवरीवन who is teaching at the international or national level they are decent teachers now you need to identify okay I'll follow him or follow her but even if you don't purchase their lectures majority of their lectures are available online every teacher if you talk about even अगर मेरे online channel पे चले जाओगे तो बहुत free content है और बाकी सर्जरी दादा के free platform पे demo lectures है so that is sufficient so first is you need to क्रिएट योर ओन सर्कल कि वो जैसे ड्रीम सर्कल होता है ना कि यू विल क्रिएट योर ओन टीम एंड देन यू विल स्टार्ट बेटिंग सो बच्चे वेरी सेम रीजन व्हाई आई केम विद माय ओन इंडिविजुअल सर्जरी प्लेटफॉर्म इज लाइक आई वाज गोइंग टू X प्लेटफॉर्म आई वाज गोइंग टू Y प्लेटफॉर्म आई वाज गोइंग टू Z प्लेटफॉर्म अब all 19 people cannot be at same level and then student is confused whom to buy at what level and that is why a new trend of single specialties have already started everyone majority of the teachers are creating their own apps so that you have a freedom to at least when you talk about the major subjects to choose wisely I understand your plight कि सब कहाँ कहाँ खरीदेंगे मैरो भी खरीदेंगे या प्रेप भी खरीदेंगे या ई गुरुकुल भी खरीदेंगे या ई मेडिकोस भी खरीदेंगे क्या क्या खरीदेंगे you know the reason I have kept this cost very low because I know that you are worried about your future but you have to spend so don't want to monetize this system दादा ने मजे का पैसा कमाया है और दादा अच्छे से एंजॉय कर रहे हैं अपनी लाइफ आई वांट टू गिव इट बैक टू यू पीपल यू नो रनिंग अ लाइव class on the app is very difficult but still I'm trying to do why because lot of students have their faith in me their future is in the question so बच्चे मैं आपसे इतना कहूंगा कि select your follow your teachers at least in major subjects तो follow कर लो बाकी minor subjects short subjects खुद भी पढ़ते हो तब भी काम चल जाता है इट्स वेरी इजी टू गो फॉरवर्ड आई होप ऋषभ आई वाज एबल टू आंसर अ पार्ट ऑफ योर क्वेश्चन anyone else who wants to ask a question न्यूरो बच्चे कोई ब्रांच नहीं सैचुरेटेड है ओके okay Vuruma is thanking me I still remember Vuruma you thank you acha not able to unmute myself okay I think the moderators have done this. Okay. Anyways, you can type your questions in the question, you can say chat box. Or still, if you have any questions, you can connect with me on my Telegram, or we will create a separate group for you all. Anytime you connect with me, I am always there for you all. I'm always there. So let me just we'll upload this video also. So you're saying, sir, any demo videos on app? स्वाति लेकर there are a lot of videos बहुत सारी videos हैं ऐप पे मतलब if you go to my app You can download it from the Android, you can say that Play Store or App Store. और सबसे अच्छा है iPad पे पढ़ते हो तो just type sajidada.classics.co.in, register yourself. बहुत सारा free content है. At least free content तो पढ़ो ना. किसने कहा पैसे खर्चा करो? Free content पढ़ो. That is more than enough. And yes, if you want to have a real swaggy feel in surgery, I'm always there. Baki, if you follow my Instagram channel, every day I post one surgery. Every day. कुछ ना कुछ मैं पढ़ाता ही पढ़ाता हूँ. But that's the only place where I'm more concerned that, okay, let me motivate few students to become surgeon. So every day I'm showing optical port. Recently, you had an image all based, you can say question in INI-CET about optical port. बाकी लोगों ने दिखाया ही नहीं, वो विदिस और ऑप्टिकल पोर्ट में समझ नहीं पाते. Okay, Rishabh says, sir, how to follow 1:2 ratio? I'm into internship. How to follow that ratio? नहीं बच्चे, ऋषभ समझो, इस चीज को समझो. When I'm talking about 1:2, you also have that same. Suppose if you are in internship, you decide, sir, I will study 8 hours. So 8 hours ka 30% should go to a practicing MCQs, and then remaining 70% should go in practicing the text or content, that is. Of that, you should at least select 3 subjects, of which 2 subjects should be a short subject, 1 subject should be a large subject, major subject. So this is how. Suppose you're studying pathology, it's a big subject. So today I'll study pathology, and along with that, derma or radio पढ़ लूंगा मैं, या psyche पढ़ लूंगा. So this is how. This is very, 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 very important. Very important. देखो सर, आपने कॉलेज में फीमेल सर्जन्स की प्रैक्टिस नहीं चलती, ऐसा कोई नहीं है बच्चे. रादर females are doing really better. Why? Because nowadays we have laparoscopic surgeries, which has nothing to do with that typical, you can say, body stature or the strength. It is all delicate, precision based surgery. Surgery की बात करोगे तो robotic surgery is again precision based surgery. It's very, 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 very easy. So don't worry about that fact. And you can always think that, okay, I want to be a surgeon, I want to be a surgeon. बच्चे ऐसा कहीं नहीं कि गायनी वालों की सर्जरी नहीं चलती है, सॉरी फीमेल्स की सर्जरी. So nothing to worry, nothing to worry. सर, आई एम इन सेकेंड ईयर, फर्स्ट ईयर के एनाटमी बहुत बार भूल जाते. अरे बच्चे, पहले सर्जरी पढ़ना शुरू करो. क्लिनिकली व्हेन यू स्टार्ट क्लिनिकल एनाटमी, देखो एवरीवन फॉरगेट्स अबाउट एनाटमी, बिकॉज द बिग प्रॉब्लम विद एनाटमी इज दैट वो you start mugging up attachments, origin, insertion, वो सब पढ़ना ही नहीं है. Study the functional anatomy, study the clinical anatomy. So this is, I would like to just thank you all, because बहुत सारे patients wait कर रहे हैं. So I would like to thank you all for joining me in this webinar. I'll again conduct a webinar very shortly. So do shortlist your questions. I will be more than obliged to answer your questions and so I would be more than obliged and overwhelmed to answer your questions, and let Dada do something. देखो यार, जो भी आज मेरे को मिला है, in a very short span of time, my students play a big role. Had I not been into this teaching business, I would not, you can say, stabilize myself so quickly. So as a gratitude, as something to return back to you, Dada will spend everything that he has or he could to just make you confident surgeons. So बच्चे, आग लगानी है, मौज करनी है. सर्जरी से अच्छा सब्जेक्ट कोई नहीं है. इट इज द ओनली सब्जेक्ट वेयर यू हैव स्वैग. 1 घंटे 1.5 घंटे किसी पेशेंट को कोई फिजिशियन बाहर नहीं बैठा सकता एक्सेप्ट फॉर सर्जन. समझे कि नहीं? सो ये जो स्वैग है ना, यही चाहिए सबको, है ना. एवरीवन शुड बिकम सर्जन विदाउट थिंकिंग क्या सैचुरेट है क्या नहीं है. और अब तो यार, don't think about that. The word is exploding in population. The need of medical infrastructure is rising. So everywhere, you be a trauma surgeon, you be a general surgeon, you be a CTVS, हर जगह हर एक का रोल है. Okay. So till then, bye bye, bye bye, bye bye.
Thank you, sir, for
everyone.
the wonderful
Hope
session.
you all
Thank you,
enjoyed.
sir.
Thank
Thank you,
you
sir, for
everyone.
giving your valuable time.
Thank you, Saurabh, and your team for organizing this conclave. And very soon, I hope we'll again conduct some
Yes, sir.
sessions for on some topics also. Till then, bye bye. I hope, and I'll share this session on the YouTube and on my app also. Okay. Bye bye. Take care.